I'm Rachel Winter. My topic today is plastic surgery, and my main claim is that plastic surgery is good for you.
I like it.
My secondary claims are that plastic surgery can make a person feel better about themselves and boost their self-esteem. And my second one is not all plastic surgery is done because a person wants to feel better about themselves, but due to health problems as well. First off, plastic surgery can make a person feel better about themselves. According to kidshealth.org, cosmetic surgery, also called aesthetic surgery, alters a part of the body a person is not satisfied with. There's a difference in the reasons that teens and adults get surgery. Teens usually get it to fit in, while adults get it to stand out. According to the cosmetic surgery stats online, teens mostly get hair laser removal and like microdermabrasion and chemical peels, and this probably helps them like feel better about themselves because like the microdermabrasion and chemical peels usually help with like acne and acne scars, and most teens I know don't like it. I don't like it. I have it and I hate it. And then they get the laser hair removal because most women obviously like shave or maybe use like something like Nair, and laser hair removal will probably help them in the long run so that they don't have to waste as much time or money trying to look nice. As far as adults, they mostly get like breast augmentation, lipo, and eyelid surgery. For men, they get breast reduction because some guys like have enlarged male breasts. And then lipo and eyelid surgery just kind of like helps them like get like a facial lift and different things like that. Researchers say that cosmetic surgery can be like an antidepressant because people who had surgery and took depression medication, they ended up stopping taking like their meds because they felt better about themselves and it boosted their self-esteem. Cosmetic surgery can help you take charge of your appearance, and by being able to change yourself to how you want to look. Cosmetic surgery can help your relationships. If you're happier with the way that you look, you're obviously going to try to make other people happier as well. My second claim is that not all plastic surgery is done because a person wants to feel better, but due to health problems as well. Patients who undergo breast reduction surgery, they're usually seeking relief from like the physical ailments that come with having large breasts. They have back problems and it just like it pains them. Children that are born with cleft lips and palates, they have the surgery because of this birth defect. The cleft lip, it can stunt the normal growth function of your nose, and it can stunt your speech development because it's harder to speak. The teeth and jaw alignment of their teeth would be off if they had a cleft lip. If you don't know what a cleft lip is, usually it's like you have like a split right here on your lip, on your upper lip. Sometimes like if you have a cleft lip, your columella, which is right here in between your nose, usually it will stunt the growth of that. And you need adequate like distance between your lip and your nose in order for it to grow right. Many people get hand surgery due to carpal tunnel and arthritis. That is considered a plastic surgery. People may have scars that are like bothersome, like acne scars and stuff like that. And not only will they get them removed because they want to have a healthy face, but because like it gains attention. Like if you have the scars, it gains attention, and people don't necessarily want attention because of the scar. They want their healthy looking skin. Eyelid surgery. Many people get plastic surgery on their eyelids. A lot of people who are usually older, ages like 51 and older, it's most common in that age area. They have like their eyelids, their upper eyelid, it kind of starts drooping, and sometimes it kind of covers their eyes, so it's harder to see, so they usually get kind of like a lift to help them see better. Some people get osteoplasty, which is ear surgery, because they have disfigured or protruding ears, and sometimes if your ears are disfigured, it's harder to hear things, so it might help with their hearing. And yeah, that's it.
Next, right?
Okay, the phrasing on the proposition is a little awkward because the phrase good implies a value judgment, and I think you want something that's more objective for a factual claim. The signposts on the secondary claims are okay. I'm not sure where there's controversy on this point, especially on the second point. Basically, it sounds like an informative speech as to what the motivations are for people getting plastic surgery. Well, why is that controversial? If there's an argument that says that people are getting excessive amounts of plastic surgery, or that people under a particular age, it's bad or dangerous or harmful for them in some way to be getting plastic surgery, you need to present that so that we know that there's a controversy here. Otherwise, it just sounds like you're describing to me what people do and why they do it. So what's argumentative about that? If you're going to render a judgment that it's safe for people to do, or that it's necessary for people to do in order to have adequate psychological health, then I think you've got a little bit more of a claim there. And then the argument is that, you know, people who jump on somebody because they're getting plastic surgery and they're only 18, they're ignoring the vast majority of people who get the plastic surgery for practical reasons that are going to benefit them in the long run. And I think you've got a good argument there, but it needs to be couched that way. Otherwise, on the second one, who's going to argue that somebody shouldn't get plastic surgery to take care of a cleft lip, or something that's disfiguring their ears so much that they can't hear appropriately? I don't know anybody who'd say you shouldn't have plastic surgery like that. That's a bad idea. That's harmful for society. We're undermining the credibility of our culture by doing that. I just can't imagine that there's any argument on that issue. So again, the big problem here is where's the controversy. Sometimes, especially in the first part of the speech, I thought you had some information about the surgeries, breaking them down, about the frequency, what's the most popular kind of surgery, what's the most frequent kind of surgery. But I didn't get any source citations in the presentation. And then later on, I'm getting a lot of those statements, well, many people do this, or some people think that, or research suggests this. And without the source citation, I can't evaluate the credibility of those claims and conclusions. So that's a little bit problematic. You've got the Porky Pig exit, you know, and that's it, folks. I'm done. And that really comes to an abrupt halt, and that, I think, hurts the conclusion there. There's a little bit more argument that's possible there if you work on it, but it needs to be developed. All right, thank you.